School of Business at UC Berkeley, and I'll be talking about my job market paper that is on mission motivation and public sector performance. Basically, um, motivating workers to exert effort on the job is a kind of a central challenge for all organizations, and many organizations try to adopt different strategies to intrinsically motivate workers besides giving them financial incentives. One of the strategies that's adopted by corporations and nonprofits alike is communicating and emphasizing the role of mission in the organization. And the role of mission is kind of central, especially to public sector organizations and nonprofits, because theoretically we kind of know that it helps the organizations attract workers that have preferences aligned with them, sort of kind of the mission match that Eugene mentioned. And anecdotally, we also know from examples that workers actually care about what their organization tells them about a mission. And an example is we observed 2 years ago here in the United States of America, where the Environmental Protection Agency kind of changed its mission statement, and that led to widespread discontent among its staff members and workers. And besides all these, there are lab studies by at least one by Shahryar, my discussant, that kind of shows that people do actually respond to the mission in terms of exerting effort. But what I want to understand and what I want to study is that can organizations actually use the mission motivation and specifically emphasizing the mission to existing workers to get them to exert effort. And the distinction here is kind of important, that I'm not interested in attracting workers to an organization. I'm looking at a status quo where people have already selected to be part of public sector organizations. What do they do in terms of their effort or in terms of their performance when an organization, their organization kind of starts emphasizing mission to them? Now, if mission does create motivation among workers and does motivate them to exert effort, it is important to understand whether that motivation is prone to crowding out, because from a large body of literature, we know that when people are given intrinsic motivation and also financial incentives, the motivation gets crowded out. And since most organizations use both these strategies together, it's an important question to understand in this context. Lastly, it's important to understand how mission works in settings where contracts are incomplete, specifically when workers are required to perform multiple tasks. Does mission do better in those settings compared to more traditional financial incentives? So to study these questions, I designed a field experiment in partnership with the Department of Health in Haripur, Pakistan. I work with their workforce that are called the community health workers. And I randomly introduce a selected set of them to what I call the mission trainings. In the mission training, I show these workers a video of their senior manager talking about the organization mission and emphasizing it to them. And then I have a facilitator who gets to help the workers talk about what the video that they saw, dissect it, share their experiences, their thoughts about it. And this mission session, I kind of continue it for 3 months. Workers meet 3 times during 3 months to talk about the organizational mission and discuss it and reflect upon it. These mission trainings also include some refresher trainings on the basic skills that the workers need to kind of make them more organic or normal looking in the context. In parallel, I provide some workers of a financial incentive. They are told that they have an opportunity to earn 25 rupees per additional household that they can visit, and over a baseline. And the baseline is set in November. In total, they can earn a bonus of rupees 500 a month. This also continues for 3 months. And I then cross-randomize these two interventions to study how the intrinsic motivation due to mission interacts with financial incentives. In parallel, for comparison, I have a placebo group, which kind of mimics the mission treatment in everything except for discussion on the mission. So these workers meet and discuss the skills and have received the skills refresher training, but they do not talk about the mission. And then I have a pure control group where the workers actually are not provided any treatment and not provided any financial incentive. As I mentioned, the experiment runs for 3 months, and in parallel, I track their performance on their actual tasks. which I'm going to explain shortly, but their main task is basically going out to households and providing basic and preventive healthcare. So to give you a preview of the results, I find that mission does motivate workers to exert effort on their job. They improve their performance by about 16% over the pure control group. The financial incentives group achieves a larger effect, which is, and they improve performance by about 27% in this context. And this result kind of makes a contribution to the literature on intrinsic motivation of workers in organizations, and also to the larger personnel economics literature, which deals with how to get workers to exert effort on their job. Second result, I do not find that the mission motivation gets crowded out when mixed with financial incentives. The combined treatment, workers who receive both treatments together also improve their performance, but by about 19%. Now, as you can see, this effect is smaller than what financial incentive could have achieved just by itself, which kind of suggests that even though there is no crowding out of intrinsic motivation, it seems like the financial incentives are becoming less effective. And with this result, I kind of make contribution to the literature on crowding out of motivation theory by highlighting, I think, that for the first time that actually there is a possibility that financial incentives also become weak when the two motivations are kind of mixed. Third, I find that this difference between the performance of financial incentives is probably driven by the difference in allocation of effort between treatments. As these are public sector workers, they perform in a situation where they have to perform multiple tasks. Mission and the combined treatment improves performance on multiple tasks, whereas the financial incentives directs effort only to the incentivized task. Which is kind of an interesting result because the limitation of financial incentives on multitasking is fairly known. But what I show here is that using intrinsic motivation through the mission, organizations can actually overcome this limitation. So moving ahead, who are these workers? I work with, as I said, community health workers in Pakistan. These are full-time public sector employees. They serve in their communities, so they do not serve in a clinic or a hospital. They have very clear geographic area which they serve. About 150, on average, these areas have about 156 households. Their core duty is outreach, which requires them to visit households each month to provide them basic and preventive services. But in that, they also perform multiple tasks. They perform antenatal checks. They inquire about health of children. They screen households for tuberculosis, and they help other staff of the health department to organize immunization camps. These workers face pretty much flat incentive schemes. They have a fixed salary of rupees 17,500 per month. And they do not really have any career prospects of moving ahead in their job. For this experiment, I randomize individual workers into 5 treatment groups, and I block the randomization at the mother facility level. So even though each worker, they work in their own community, they are nominally connected to a facility where they submit their reports and get their medicine stock from periodically. So I block randomize on that facility level. How do I measure their performance? So measuring performance in public sector is kind of not easy because of at least 2 reasons. One, as I said, they perform multiple tasks, and it's not cost effective for the public sector, at least, to have systems to keep track of all these multiple tasks. Second, their existing monitoring systems is almost non-existent. These workers report their performance on paper-based forms, and they record it in paper-based registers, which are highly inefficient and also prone to manipulation. So instead, I design a survey of the community where I send my own survey teams to visit 10 households in each community each month. So in total, I survey about 7,000 households every month for 3 months. This survey is very short and crisp. I ask them, my teams ask the households whether their worker visited them during the last calendar month, and then ask a few more other questions. I also have baseline and endline survey of workers. and also arranged a lab in the field, incentivized the activity with the workers to get at some of their intrinsic preferences. So in terms of timeline, I did the baseline surveys in December 2018. The experiment started in the first week of February 2019. The first survey to collect information on performance started in the first week of March 2019. These activities continued for 3 months. The experiment ended on 30th April, and the survey ended in, the last survey ended in May. Now, after the experiment ended, I still fielded another survey to just gather information on the performance of workers to understand decay of what happens after the experiment to the performance of these workers. Moving to the results, this is the main estimation that I'm going to be using for my main results. The dependent variable is a dummy that takes a value of 1 if a household reports that their worker visited them in a given month. And I use treatment dummies for each of the 4 treatment conditions, including placebo. And the pure control group is always the left out category. So I may not be showing you all the results in all the tables and figures, but I always run a full regression. So moving to my first result, what happens to the performance of workers when they receive this treatment? Here I'm reporting the results, the effect on the probability of a household being visited. So the first result, as you can see, that mission does matter. It improves performance for workers by almost 5 percentage points. This means that they visit about 9 additional household compared to the status quo in a given month. The financial incentive improves by about 10 percentage points. And this means that they improve performance by about 16 additional households in a given month. Now, what happens when the two are combined? As I told you in the preview, I do not find that the financial, the mission, the intrinsic motivation gets crowded out. So the combined treatment still has a positive performance effect, but this performance effect is almost similar to that of the mission and very different from that of the financial incentives. Now, if I were to stop at this figure, you will probably take away 2 lessons. One, that mission actually does improve, but the improvement is smaller. And 2, that the combined treatment workers are kind of leaving money on the table. But these, if you go away with that result, you are kind of ignoring the key design aspect, and that is that this is an environment where the workers are required to perform multiple tasks. So we move ahead and try to see what happens on these other multiple tasks. And I track 5 multiple tasks. You can broadly think of some of them as core multiple tasks. These are things which the workers are required to do when they visit a household, which includes antenatal checks, examining children, talking to the household about disease prevention. These are their core duties. But then there are also other multiple tasks which are non-core. One is screening households for tuberculosis. So the health departments have other people who are there to fight the spread of tuberculosis in Pakistan. But these workers can go and screen households and then recommend them to go visit the facilities and seek services of those specific personnel that treat tuberculosis. The second is that these workers are community health workers. They are not immunization technicians. They are not trained to perform intravenous immunizations, but they can help the immunization technicians organize camps in their community so that the people in the families in their community can get their children vaccinated. So I have information on all these 5. For the first 4, the information comes from the household surveys. And for the last one, which is the immunization camps, the information comes from self-reports. I combine all of these in an index using Michael Anderson's 2008 paper. Since these are 5 different outcomes, there may be some correlations with them. Michael Anderson proposes a method in which you can construct a standardized index that is weighted by the inverse of the variance covariance matrices of the data. So what do I find on this index? What I find is that mission actually motivates workers to improve their performance in terms of multiple tasks. People who received the mission training performed about 0.16 or more standard deviation more multiple tasks. Those in the financial incentive actually has no effect on multiple tasks, which is kind of the standard result in economics, because these people do not get paid to perform multiple tasks, they get paid only to visit households. The workers in the group that receive both the treatment also improves in terms of multitasking. And again, their performance is closer to that of mission compared to that of the financial incentive, and the performance, the effects are actually very different from each other. So what I've showed you till now is that basically mission does motivate workers to improve effort on their core task, which is household visits. I do not find that combining mission with financial incentive crowds out, but what I do find is that the mission actually makes the financial incentive appear to be less effective. And then I show you that this is probably because the mission actually motivates workers to improve effort on multiple tasks, making workers better on all-round kind of activities, whereas financial incentive does not. So now I move to some of the mechanisms of why this might be happening. And I'll be showing you results on 3 mechanisms. And I'm going to argue that the main mechanism here is that mission intrinsically motivates workers to perform. For that, I will be showing you 2 results. One is an index of beliefs about alignment of preferences, and the second is a lab in the field activity, through which I measure some sort of altruism. So first, at the end of the experiment, I fielded a survey with the workers in which I tried to gauge their motivation and their beliefs about alignment of preferences between themselves and the organizations. And from that, there are basically 3 statements that I like to focus on, where I ask the workers, do you agree with them or not? And the statements are, I like the LHW program. LHW program is the specific division within the health department that employs the community health workers. I like the LHW program more than other departments because of the importance it places on mission. I believe the LHW program mission is very similar to my thinking. And if the LHW program was something else, I would not be as attached to the program. I combine them into an index, and what I find is that, again, mission and the combined treatment workers actually report a higher belief that their preferences are aligned with the organization. Whereas the financial incentives, workers do not report, do not believe that they have preferences aligned. So this kind of is one piece of evidence that mission did motivate workers. The second piece of evidence, I fielded a lab in the field activity. I'm extremely sorry if you hear background noise of my child crying, but I would like to focus. So I fielded a lab in the field activity with the workers 1 year after the experiment. This was supposed to be an in-person activity, but because of COVID, I had to modify it. And the activity was supposed to elicit their willingness to work using a BDM sort of mechanism. And this is how the activity went. We basically called the workers on their phone, and we told them that we would like their help in preparing lists of households that have pregnant women and children. But we want to see if we can pay them for this, for performing this activity. And for that, we haven't decided the exact rate. However, we are going to tell them a menu of rates, and they are to tell us through a message or a phone call to make their responses private, whether they accept each of these, or for each rate, whether they accepted the rate or not. And one of the rates was basically doing the activity for free. We told them that the final decision will be collected at random from these rates that we offer them. So I take their responses to their willingness to work for free, and I use that to see whether the workers who received the mission and the combined treatments were more likely to work for free or not. So in this table, as I said, the dependent variable is a dummy that takes a value of 1 if the worker reported that they are willing to perform this activity for free or not. And here, you can see the first row, the people who receive the mission treatment actually are 10 percentage points more likely to agree to perform this activity without getting any compensation. People who receive the financial incentives are actually less likely. Their effect is not statistically significant, but the point estimates is fairly large. And people who receive both the mission and the financial incentives are again more likely to accept to work on preparing a list of pregnant women and children for free. This result we take as a second piece
Quickly. We have a minute to go.
Okay, well, this result I take as a second piece of evidence that yes, intrinsic motivation, the mission works through intrinsic motivation. Now, I'll quickly show you that if treatments did not have any differential effect on the perception of being monitored, so you may have thought that, oh, the mission may work because it primes the workers that they are being monitored, but I do not really see any difference in their perception of being monitored. You may also think that the mission actually provides some information on the task that they should focus on. If that is the case, I have a placebo treatment where they receive the trainings on on how to deal with pregnant women and children, and I do not see that the placebo treatment leading to any improvement in performance. So in terms of further results, I do find that the decay in the effects of mission is slower compared to the financial incentives. Workers in the mission treatment are likely to exert higher effort even after the experiment had shut down. These improvements in performance also lead to actually better health outcomes for the community. And I have an additional result that in addition to being individually motivated, I do not see that the workers actually get influenced to their peers. Now, to conclude, and with this paper or with this experiment, I'm trying to provide provide evidence from a field experiment that mission actually does motivate workers. And that motivation does not get crowded out when the organization also uses financial incentives. But mission works much better in this context of incomplete contracts where workers are required to perform multiple tasks. These results have specific implications for developing countries where contracts are incomplete or where the institutions are weak and cannot enforce contracts to the full. Thank you very much. I'll soon float the draft of my paper on my website. So in case in the future you want to have a look, please do visit my website. Thank you.